Hi, today we're going to be talking about low back pain. 70 to 80% of adults experience some sort of low back pain in their lifetime. It is also the leading cause of disability worldwide. There are many ways that one can injure their back. The most common back injury is a muscle strain. This can be caused by lifting improperly or making a sudden movement, twisting the wrong way, falling down, carrying something that's too heavy, carrying excess body weight, or poor posture. Although a muscle strain is not as serious as a bulged or herniated disc, it can still cause extreme pain and muscle spasms. The main muscles that we have in our back are, we have the trapezius muscles, we have the erector spinae, we have the latissimus dorsi, which run down the sides of the back, and we have the rhomboids, which support around the shoulder blades here. We also have something called trigger points all through our body. So trigger points are basically places that can get inflamed and radiate pain up or down a nerve branch depending on where it's located. So even in just our back, these are all the trigger points. The yellow dots here are all the trigger points that we have in just your back area. So there are something called trigger point therapy. So we have an S hook here. So what you would do is you would take the S hook, or maybe a tennis ball, or they sell these lacrosse balls or trigger point balls, and you can place the ball in that area and lay down or against a wall, or use an S hook, find the spot, and then gently dig it in. So with the trigger points, you really want to try to apply pressure for anywhere between 30 seconds and a minute at least, and then you can kind of release it and then maybe move it over a little bit more and try it again. So the trigger point therapy is one of the best ways to try to release that trigger point. But moving up and down, so you can have a trigger point maybe in your neck and get pain radiated down into your hand, or you might have a trigger point in your hip flexor that can cause pain in the front of the knee. So sometimes the pain that you're feeling may not necessarily be coming from where you're feeling that pain from. So just keep that in mind. One of the muscles in your back is called quadratus lumborum, which is the area that runs right here, the band right above your glutes. And so that's actually one of your innermost abdominal muscles. That area in particular gets trigger points that can cause pain down into your glute area and your low back area. So anytime that I am feeling any sort of low back pain, that's usually the first place that I go to try to minimize the pain, is do trigger point therapy in that low back area. Another thing that we don't often think about with our low back pain is weak hamstrings. So when your hamstrings are tight or weak, it can affect your posture in a negative way. Another thing is when we sit for prolonged periods, what it does is it shortens the hip flexor muscles, right? So this muscle is going to get shortened and tight, which in turn then causes your glutes to not fire correctly, which is a large muscle. We want them to make sure that they're firing correctly. When your glutes don't fire correctly, then your hamstrings get tight and weak because they try to overcompensate for the glutes not working correctly. So you want to make sure that your core stays strong and that your glutes stay strong to support everything. So your core muscles are your rectus abdominis, your transverse abdominis, and your oblique muscles. And they also wrap around to your back and your glute area. So this whole area is your core. When your core is not working correctly, then this area, you'll get an anterior pelvic tilt, which kind of means that this area is shortened, so you're kind of sitting like this, or standing like this, and it kind of mimics sitting even, right? And then, so if you have an anterior pelvic tilt, your shoulders are going to kind of round forward and your stomach is going to kind of protrude a little bit, and that disengages your core and makes your core weak. So you want to make sure that your posture is correct, drawing the shoulders back and down and keeping the abs engaged, your core engaged, so you're supporting your back very well. If you do get injured, especially at work, you want to make sure to see the nurse or see Tara, so that way you can get care immediately. You also want to do the RICE method. So you're resting, icing, compressing, and elevating. So obviously it's kind of hard to compress or elevate your back, but you definitely can rest and ice. So those two things are very important, especially when you get injured. So that way you're listening to your body. I think the most common mistake that people make is like to try to push through the pain when they're feeling any pain, and then they end up getting injured for longer or making the injury much worse. So listen to your body and make sure that you're at least resting and icing. Also, if you can take some sort of anti-inflammatory like an ibuprofen, it's not a bad idea to do that as well. When you are ready to stretch, so the other thing is like people jump right into stretching when they get injured thinking that they're going to kind of stretch the muscle out, but that's not necessarily a good thing. So your pain scale on a scale of 1 to 10, with 1 being like nothing and 10 being very, very painful, you want to make sure that your pain scale is around a 4 or below before you start any sort of stretching. Your body otherwise will guard against the stretching, and you might again increase that risk of injury or make the injury much worse. So we're going to go over some of those immediate stretches that you can do after you get done resting and icing and that your pain scale is less than a 4. And we're also going to go over some stretches that you can do every day to prevent having any sort of back issue or tight hamstrings. And we're also going to go over some core exercises that you can do every day as well. However, there are things that you can do to try to prevent injuring yourself in the first place. So one is using proper ergonomics when you're picking something up, when you're sitting down to standing up. You want to make sure that you're using your core and you're lifting with your legs. The other thing is to not lift things heavy. So if you have something that you know you have to lift, maybe you wait for a friend or family member to come over to help you lift it instead of thinking that you can do it all on your own. And then the other thing that you can do is to strengthen your core, like I said, to try to support the back muscles. And lastly, you can decrease your body weight. So if you're carrying excess body weight, it puts a ton of more pressure on your spine than if you weren't. So if you lose 4 pounds, only 4 pounds, it reduces the pressure on your spine by 16 pounds. So that's quite a bit of extra pressure. Also, if you're sitting for your work, it puts 90% more pressure on your spine than standing does or walking. So maybe you set an alarm to make sure that you get up and walk around a little bit during the day if you have a job where you're sitting more frequently than others. There are many types of exercises that you can do to try to make yourself a little bit healthier. One is walking or jogging. It's weight bearing, so it helps to increase your bone density. 2 is strength training, which makes your muscles stronger, so you support your joints and your bones. Doing some sort of yoga or flexibility, stretching is really good for you because it keeps the muscles pliable and loose. And Pilates is one of the best types of exercises I think that you can do to strengthen your core. So whatever exercise you choose to do, some sort of exercise is always better than no exercise at all. So when your pain scale is less than that 4 on your scale of 1 to 10, the first couple of stretches that are usually okay for your back would be to come down onto your back with your legs either up on a chair or a couch or a table, and just allow your low back to sink into the ground. And I would hold that for anywhere between 1 minute to 2 minutes or 5 to 8 long breaths. And the other stretch that is usually okay to do at the beginning would be to lay onto your stomach and then extend the arms and the legs straight out. Arms forward, legs out. And if that's too much for your back, then you can always place a pillow or a rolled up towel or blanket underneath your hips to try to elevate the hips a little bit more and just try to traction your back. So you're really just trying to lengthen out through the vertebrae. Once you're no longer in pain or very minimal pain, then there are some stretches that you can do every day. So with these stretches, we're going to start on your back. And the first stretch we're going to do is pulling your knee into your chest and lowering the other leg straight down to the ground. So you want to try to imagine drawing the knee in towards the same side shoulder and gently pressing the other leg down towards the ground. Again, we're going to hold that for anywhere between 30 seconds and 1 minute, or 5 to 7 long breaths. The next one that we're going to do is we'll switch sides, and then we're gonna draw the knee towards the opposite shoulder. So the hip stays down on the ground, and you're just drawing the knee up and across towards the opposite side. Again, we're gonna hold that for about the same amount of time. The next stretch we're going to do is the figure 4 stretch. So if it's too much for you to lift the leg up, you can either hold onto the foot and the knee and reach through and pull it towards you, or if that's too much for your back or your knee, you can leave that bottom foot down and draw the knee up again as it's crossed over the thigh. So listen to your body and do whichever one is more comfortable for you. The following stretch is going to be a hamstring stretch. So the only time that you don't want to do a hamstring stretch is when you're getting sciatic pain nerve down the back of your leg or the front of the leg down into your foot. So with the sciatic pain, you're going to want to skip this one. But otherwise, you're going to flex the foot, pulling the toes back towards the shin, and try to keep the leg nice and long. So if that means that you need to use a band, a strap, a rope, or a towel to place around your foot, you can do that. And this leg can either stay bent, which places a little less strain on your back, or you can lower the leg all the way down to the ground. So again, listen to your body. The next one we're going to do, we're going to swing around onto your hands and your knees for cat-cow. So the hands are going to be under the shoulders and the knees are going to be under the hips. And you're going to round through the back, drawing the navel to the spine and the chin to the chest. And then you're going to arch through the back, lifting the tailbone, rolling the shoulders back and down, and lifting the forehead up to the ceiling. So continue at your own pace, cat-cow. Good, and then the next stretch on the list is the Sphinx. So you're going to come down again onto your stomach, and we're going to slide the elbows underneath the shoulders, lifting the chest to the ceiling. So you want to try to relax your glutes, relax the legs. If it's too much of a bend in your back, you can always walk the arms forward so there's less of a bend in your back, or you can come all the way flat down onto your stomach. And then the last stretch in this one is to sit the hips back to the heels into child's pose. So either knees or open feet together and sit the hips back, or knees together and feet together and sit the hips back. So remember that one of the best ways to try to prevent low back pain is making sure that your core is nice and strong. So these exercises you can do every day. I did not put a number of repetitions on here, so you want to make sure to listen to your body and find a number of repetitions that's challenging for you, but where you can do them with perfect form. So the first exercise is a plank, either on your elbows and knees, or elbows and toes, or hands and knees, hands and toes. So listen to your body. Either way, you want to make sure that your navel is drawn in towards the spine and you keep breathing. The second exercise is bird dog. So you're on your hands and your knees and your spine is neutral, and then we're going to lift the opposite arm and the opposite leg up and hold it. Again, you want to try to make sure that your hips are square to the ground. And then you'll switch sides. The third exercise is a side plank. So again, you can go elbows and knee. So you want to make sure the elbow is directly underneath the shoulder and your hips are lifted. You can extend the top leg or you can extend both legs. So listen to your body. And again, you're going to hold it for as long as comfortable where it's challenging for you, but you still have good form. The next exercise is the swans. You're going to squeeze the legs together. The hands are under the shoulders, and you're going to lower and lift the torso up and down without using the arms. So you're really concentrating on using your core, your low back, and your glutes to lower and lift the torso. And then after you're done with this one, it's wise to sit the hips back to the heels, just to round through the back a little bit and stretch before you go into the next exercise. So the next exercise, we're going to swing around onto your back, sliding the hands slightly underneath the hips, and then lift the legs up so the calves are parallel to the ground. And then you're going to alternate lowering the foot down and forward as far as you can without arching through the low back. So if that means that you have to stop here, that's okay. Or you can take the foot all the way down. So listen to your body. And then the last exercise is bridge. So we're gonna walk the feet hip width apart, and we're gonna slowly lower and lift the hips up and down, one vertebrae at a time. Pushing through the heels and squeezing through the glutes and the core. Good. So again, I didn't write down a number of repetitions, and if you need any of the stretches or the core exercises sent to you in some sort of document, then just let me know and I'd be happy to send it out to you. If you have any questions, feel free to email me, and I hope you have a great day. Thank you.